My name is Lauren Vasquez. My pronouns are she, her, and I am a program specialist and facilitator of our Youth Advisory Council at the Adolescent Health Initiative, or AHI. I'll be your MC for the day. I am a multiracial woman of color with tan skin, brown eyes, curly red shoulder-length hair. I'm wearing a University of Michigan Navy fleece, and I'm sitting at my desk in my home office in what is now known as Ypsilanti with a bookcase behind me. At AHI, our mission is to transform the healthcare landscape to optimize adolescent and young adult health and well-being. Our team works to fulfill our mission through coaching, training, and innovative resource development, in addition to holding this annual event and our annual conference on adolescent health. We are so excited to learn in community with all of you today. Before we dive into the content, we'd like to share some information about today's event. Throughout the day, you can contact Adolescent Health at umich.edu if you need any support. Please be sure to keep your microphone on mute as to not create background noise during the presentations. Today's event will be recorded and shared with attendees after the session. Breakout sessions will not be recorded and the chat transcribe will not be saved. If you don't feel comfortable with your Zoom screen being recorded, please send us an email and we'll do our best to edit it out of the recording before sharing. In the chat, you'll notice a link that reads bit.ly/2021CS resources. Here you'll find information about this event, including a Google Sheet that invites you to share resources that have been supportive of your learning around racial equity and justice. We encourage you to check out the resources listed and add those that have been helpful to you. Continuing education credits will be available for attending today's event live. To receive credits, you'll need to complete the conference evaluation that will be sent out on November 18th. For each speaker presenting today, there will be opportunities for Q&A at the end of their session. So please enter your questions into the chat as they come up for you. So today, through the expertise of our speakers and panelists, we hope to define structural racism and how it has manifested both historically and in present day healthcare for adolescents, explain the health impacts of racial inequities in adolescent healthcare for youth with intersecting marginalized identities, and identify and develop actionable strategies to manage implicit bias and implement anti-racist principles into your professional practice. Today's agenda includes a framing session by Jana Behrens, a background session on structural racism and adolescent health by J-Med Carbia, a panel discussion on impacts of racism on adolescent health with Teresa Springer, Dr. Vinod Chulani, Jessica Taylor, Saida Abshir, and Ashanti Campbell. And then we'll close with a strategy session on care, not punishment, rejecting carceral logics as part of anti-racist practice led by Maria Thomas. You can follow along with today's event and join us in collaboration by interacting with our social media accounts at the links on the slide. At AHI, we understand that we are not the experts in race and racism or how it impacts adolescent healthcare. So instead, we've brought together a community of folks that have specific expertise to share their work and center voices of people in the field that have shared experience and are doing this work intentionally. We understand that this work is never done. We are actively working, learning, and growing, and we invite you to do the same. It's now my pleasure to introduce you to Ariel Banks, who will be co-facilitating with me today. Ariel Banks is a senior at the University of Michigan pursuing a bachelor's degree in biopsychology, cognition, and neuroscience. She works as a phlebotomist at Michigan Medicine and is passionate about adolescent health with a special emphasis on mental health and well-being. She is a new member of AHI's Youth Council TAC and is excited to shape the future of adolescent healthcare. Ariel is also a member of the Black Undergraduate Medical Association, where she has been able to mentor high school students throughout their transition to college. In her free time, Ariel likes to do yoga, meditate, and spend time with her friends and family.
Thanks for the introduction. Again, my name is Ariel Banks. My pronouns are she, her. I am a biracial, light-skinned woman with long curly brown hair, and I am so excited to be co-immencing this event.